Hello and welcome to Pune Times Mirror. Joining us today is a young visionary leader from Pune's rapidly evolving healthcare sector. Dr. Divij Mane is the director of Noble Hospitals and Research Centers. As a part of Pune Times Mirror Advisory Committee, he is here to talk about the role of healthcare, rapidly evolving innovative technologies, and how Noble Hospitals' vision in shaping betterment of Pune. So, hello and welcome to Pune Times.
Well, Anaum, thank you so much for calling me here. It's an honor to be at the Pune Mirror's office, and I thank you for welcoming me to the advisory committee. And let me tell you, if the citizens should know more, Pune Mirror is one of the best and the most respected newspapers out there in Pune, actively taking the helm in their own hands to drive this city into a better future. And to be a part of this advisory committee gives me an opportunity to serve them also and serve my citizens in Pune. And being a doctor, whatever I can bring for the healthcare industry in Pune through Pune Mirror and drive some initiative that will put Pune on the map for healthcare is my vision for this advisory committee. And I thank you for inviting me for that.
Okay. Apart from healthcare, what other sectors do you think Pune needs to improve in?
Well, if there are many sectors definitely, but if I have to point out regarding my healthcare sector, the healthcare and the hospitality sector can go hand in hand. And I had written an article recently about how medical tourism can boost not only the healthcare sector, but also the hospitality sector. And I'm glad that the finance minister has recently announced a 20,000 crore budget specifically for this, to support the highly as well as the low skilled workers in our sector. A lot of our talent is going outside. You see doctors, aspiring young doctors which are going outside to developed countries or Western countries. We are losing out on this talent. We are having nurses, we have a huge nursing attrition in India, and there's a global crisis, but India is getting the grunt of it, having good population, but yet this population is going out because there are not good opportunities in India. There are opportunities in small pockets, like we have 40 JCI or Joint Commission International accredited hospitals in India, which give you healthcare at the highest level in the world. So if you see you do a heart surgery at somewhere in Mayo Clinic, which is considered the best hospital in the world, you can rest assured that you are now getting the best surgery or the same level of heart surgery in Pune city, because Noble has strived, or Noble's vision was to get internationally accredited by the Joint Commission. So there are 40 hospitals like this in India and only 1,000 in the world. So we are very proud to represent Pune on the world healthcare map. And now the government, how it's boosting the tourism industry is, they are going to invest in connectivity by building a very nice airport, state-of-the-art airport, which is upcoming in Pune, which will get us internationally connected with many Western countries.
Pune is emerging as a tertiary care hub, right? What would you like to say about that?
I would say that Pune has traditionally already been a tertiary care hub. I mean, Pune was always representing Maharashtra in India. Pune has always led the various industries like healthcare or culture itself. Now, I'm proud that Pune is represented also on the world map, not only as a tertiary, but as a quaternary healthcare center, because there's a JCI hospital in Pune.
Oh, nice. So what would you like to say about new technologies coming in, and how is Noble Hospital adapting to that?
So whenever we get a new technology, it has to become viable in a country like India. You can get costly tech in India, but we have to make it affordable for our population and the volume that we have. So when you get good tech, you have to ensure you have competent doctors, you have competent healthcare staff, you've got competent nurses around the clock, because we have much more, I think 100 times more, you can say, the volume that any Western country would have. For that, to make it affordable, you need to ensure that you have the right plan. Now, what do I say about right plan? You have to start investing in the youth. So, Noble Hospital is one of the largest DNB or medical education programs in India. Every year we have aspiring doctors coming from the north, the south, the east and the west to learn the art of medicine. And luckily at Pune, in Noble now, they can learn it at a level which is international. So when they go back to their hometowns, when they go back to the tier 1, tier 2, tier 3 towns or villages, they get the same quality of healthcare, and that is what is making difference today. So technology, yes, it should be there, but it should be tuned into competent doctors for you to actually harness the technology.
How does your core values, like the patient doctor-patient relationship, remain intact? How do you make sure that happens?
Well, there is nothing more important than a doctor-patient relationship. I'll tell you how. A doctor not only cures your disease, but he looks for the source. Sometimes that source can be physical, most of the times. Sometimes that source can be mental. So when you go to a physician, that physician should be able to treat you both physically as well as mentally.
Yes.
And to create that situation, you need to have a patient-centric approach. What do you mean by a patient-centric approach? So when you come to a hospital, you expect that you not only treat your one ailment, but you treat the patient as a whole. It should be a holistic approach. That's what we do. So when you come to our hospital, or any hospital which is JCI, you get an individualized, tailored healthcare plan. Now this healthcare plan is based on the world's leading protocols, the world's leading evidence-based medicine. And that is what we individualize for you. So another thing about doctor-patient relationship, and I spoke about patient-centric focus, is there are 3 words that we go by in Noble Hospital. There is patient care. When you talk about patient care has to be ethical, patient care has to be holistic, and it has to focus on your needs as a patient, which we give. Obviously combining with the world's leading evidence-based medicine. Then the second key word in this is patient satisfaction. When you as a patient go to any hospital, you should be satisfied while you're going home that I have been taken care of. And I know what is going to come, and I know how I can, counter it, how I can keep my health with me in the future. And the third is patient safety. Now, unfortunately, when you talk about patient safety, not only in India, but over the world mostly, patient safety is more than often, if not neglected. An example of patient safety is we follow some international patient safety goals. The first international patient safety or IPSG goal is identify the patient correctly. So given the volume that we have in India, it becomes so crucial that we spend time in identifying. Every time we talk to the patient, we must understand what is the name of the patient, what is the medical record number of the patient, or another unique identifier is what is the date of birth. So if there are 2 Anaums coming to me in a hospital, I should know that I'm giving the right treatment to the right Anaum. And that is where it is so easy to do it. It is so easy to avoid this mistake. Like we were speaking about having some cases where there are certain instances which is also common in many parts, is during surgery some swabs are left inside the surgery. Now it's a sad reality. How can we avoid it? By a simple mob count that we do before and after the surgery. So international patient safety goals like this, whether it's your surgical checklist or whether it's a unique identifiers for identifying the patient before every interaction, this is what creates patient safety.
So what are Noble Hospital's future plans?
In terms of future, Noble Hospital is currently a 330-bedded hospital. Within the next 4 months, we are going to become a 600-bedded hospital by adding 2 more centers and another specialized mother and child care center. And another 7 months down the line, Noble Hospital is going to reach about 800 beds with an addition of a super specialty and oncology focus center. And in, let's say, about 2.5 years down the line, we aim to become a 1200-bedded institution.
That is great. With so many diseases and outbreaks coming to fore, so much of development and technology being in Pune is really essential. It's for the safety of people. It's because of heroes like you. Thank you so much for being here.
Thank you so much. It was a pleasure, Anaum, and hope to serve my best for the advisory committee, whether it's any civic issues or whether it's related to the transport issues that we may face and which might become worse, and how we can address that and how we can bridge the gap in terms of the development that is planned by our excellent leaders that we've elected. Thank you so much.